For many people diagnosed with the most common form of early stage breast cancer, the risk of it coming back remains a significant and lifelong concern. The leading minds in breast cancer research just gathered to discuss the latest advancements in care, including a new treatment approved to help prevent reoccurrence of early breast cancer. Joining us today to discuss these updates is Dr. Kevin Kalinske, Medical Oncology Division Director at Emory University School of Medicine. Good morning, Doctor. How are you?
Good morning. Thank you so much for having me.
Thank you so much for joining us. So, what does the latest research suggest about the risk of cancer coming back following an EBC diagnosis?
Right. So EBC stands for early stage breast cancer, and that is the majority of patients that we see with breast cancer have early stage breast cancer, which really means that the breast cancer time of diagnosis has not spread to another part of the body. And thank you for calling out the San Antonio Breast Cancer Symposium. This is an important meeting where doctors across the globe fly to Texas to talk about the new updates that we have for breast cancer. And we've seen that the risk of recurrence can still exist for everybody, including patients who have node negative breast cancer, right, where it hasn't spread to their surrounding lymph node.
Now, what should people know when speaking with their care team about their risk of cancer coming back? Are there any recent developments patients and their doctors should keep in mind?
Right. So increasingly, when we're treating patients with early stage breast cancer, this is not a one size fits all approach, right? The patient that's in front of us, we tailor their treatments based upon them and the early stage breast cancer that they might have had. So, we have seen the recent approval for patients who have estrogen-driven breast cancer that is HER2 negative, which is the majority of patients. We've had approval for CDK4/6 inhibitors, including in September, we had the approval of Kisqali for patients, which is a pill that patients take for 3 years, along with their endocrine therapy, which is also a pill. And so what we've seen with this drug is it offers benefit for patients. The side effects include things like decreasing their blood counts and maybe fatigue or gastrointestinal issues. But it's always important that you discuss with your doctor to see if this is the right sort of treatment for you.
What else did the research shared at the SABC's meeting show?
So it really showed a few things. And one of those is that for patients with early stage breast cancer, and we've seen this in the real world, that for patients who have breast cancer that has spread to their surrounding lymph node, but also for patients with high risk node negative breast cancer, the patients may remain at risk. We've also seen that with CDK4/6 inhibitors, including the Kisqali, which I just mentioned, that it decreases the likelihood of it spreading to another part of the body by about 25% in terms of its relative risk reduction.
Now, how are these advancements reflected in treatment guidelines, and what can patients expect when discussing treatment with their physician?
All right, so there are additional resources that patients can go to get information. This includes websites like the National Cancer Institute, Breast Cancer Research Foundation. There are also institutional websites as well that can explain breast cancer and stage and types of treatments that we have available. And if you want more information about the drug that I just mentioned, you can go to Kisqali.com. That's spelled Kisqali.com. And that will also give more information about the drug, how it works, and the risks and benefits of it.
Doctor, one more time, where can our viewers go to get more information?
Sure. KISQALI.com is a way to get more information about the drug that I just mentioned.
Been speaking with Dr. Kevin Kalinske. Thank you so much for joining us on Morning Blend. Of course, this interview is taking place during the holidays, so happy holidays to you, Doctor.
You too. Thank you so much.
Thank you.